Hi, Mahtab.
Hi, how are you?
Good. What's going on with you today?
So basically, I'm just having a little bit of issues with my scalp. I
Okay.
do get a little bit of like itchiness, and sometimes it's like there's like a feeling of numbness.
Oh, okay.
So that's been happening for a few days.
A few days. Okay.
And also, like my abdomen, I'm getting a little bit of pain. It's not constant, but it kind of like comes and goes. So
Okay.
that's why I wanted to come here and basically check it out.
Sure.
Yeah.
Yeah. Could you describe the stomach pain? Is it a nausea or is it more of like?
It is nausea.
Okay.
Yes.
Sorry about that.
Sometimes after I drink water, even so, even if my stomach is not really full, it still happens, and
Okay.
it happens. I would say like a couple times a day.
Okay.
So
A couple times, so it's not persistent throughout the day.
it comes and goes, so not like the whole day, but it's
Okay.
been going on for, I would say, like 3-4 days right now.
I'm
So,
sorry.
Yeah.
So have you noticed any patterns with diet? Like, does it happen after you eat certain foods, or have you changed your diet?
I have changed my diet recently just because
Okay.
I'm very busy, so I don't really have time to cook meals at home, so I do eat out.
Okay.
I am thinking maybe that is the reason. However, even if I eat healthier food, I've noticed that it happens from time to time. So,
Okay.
yeah.
Okay. So I'm seeing maybe you have some symptoms of gastritis, but I'm going to take a closer look later on. So on a scale of 1 to 10, how would you rate the pain right now?
Honestly, I would say like a 6.
Okay.
Yeah, it was a little bit worse before I came in.
Okay.
Like I said, it kind of like comes and goes. So
Okay. Yeah. Okay. And is it more like in the morning, at night, or just comes and goes?
Mostly in the morning and before I go to sleep as well. So
Okay.
I've noticed right before I go to bed, it happens, and it
Sure.
causes like sleep
Sure.
issues for me. So
Yeah. Are you taking any medications on a daily basis?
just over the counter.
Okay.
I take Tylenol, but nothing else.
Okay. All right. Any family history of medical issues I should be aware of?
Well, my mom has diabetes,
Okay.
but she never had these symptoms actually. But
So this is pretty separate.
yeah,
Surgeries in the last year?
no,
Okay.
no, I didn't.
All right. Any traumatic events? It could be physical, like did you have a fall, or
It was last week actually. I was kind of like running to my car. I was running a little bit late that I had a fall, but I kind of like fell on my knees. So that was the only thing I can think of.
Okay.
Emotionally though, it has been a little bit tough just because of my work situation. I wasn't unemployed for a few months. And
Okay.
So I would say that was also happening.
That can definitely trigger a lot of psychosomatic symptoms, stressful events. So,
Yeah.
But I will take your physical symptoms just as seriously.
Yeah.
Either way.
Okay.
And with the scalp itching, have you used any different soaps, shampoos, conditioners? Any changes to your skin routine?
I used a new mask. It was a hydrating mask, but when I put it on, I had to take it off right away just because it was causing lots of itchiness, and I felt like a sense of burning. So I removed it, but I didn't use it again. And then the next day, the itchiness happened again. So that was the newest product that I used recently.
Okay. And did the onset of the scalp issues start after that?
Yes.
Okay, so that definitely could be a culprit.
Yes.
Okay, I think I have all the information I need for now.
Okay.
I'm going to take your vitals real quick, and then we're going to look at your head and also your abdomen, okay?
Okay.
Any questions?
No, thank you.
Oh, I have one more question for you. Are you taking anything right now over the counter to alleviate either of symptoms? Like you mentioned Tylenol. Are you taking that currently?
I am taking it.
Okay.
Yeah, I actually took one this morning before I came in. So.
Okay.
Yeah.
Great. So I'm going to start just by listening to your heart and your lungs. Okay. So if you could just breathe normally for me first. Okay, sounds are normal. And listen on the bell side. We hear S1 and S2, no S3. I don't hear any murmurs or extraneous sounds. So that's good. You take a few just bigger breaths for me. I'm listening to your chest. Listening for congestion or... Very good. And again. Okay, I'm listening to your lungs now.
Okay.
So if you could take a couple really deep breaths. Excellent. And again. Very good. Are you a smoker?
I'm not.
Okay, good. Your lungs sound very clear, so keep up the good work. And I'm going to take your blood pressure next. Okay. All right, make sure your legs are uncrossed. Yes, they are. Perfect. Okay. 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 Okay, that's 109/75, so that's excellent. Slide this off. Okay. Okay, so let's 109/75. Very good. I'm going to grab your temperature. All right, that's 97.9. And next I'm going to get your oxygenation. So, if you could give me your index finger. And you have really pretty nails.
Thank you.
Wow. So just relax. Okay. Okay, your heart rate is 70 beats per minute, which is excellent. And your oxygenation is 99% oxygen or room air, which is fantastic. So your vitals are really good.
Okay, thank you.
Yeah. Okay, so if you could close your eyes, I'm just going to take a look at your skin and just examine, just to see if there's any issues with your skin on your face. Okay, your skin is very well perfused. I don't see any redness. I'm just going to look at the hairline as well. Okay, I am seeing redness up here. Seeing some redness and also some scaly patches, so it does look like it's an allergic reaction. I'm pretty sure it's a separate issue from your stomach, since this looks like a topical something good mask you put on your face might have irritated it. Okay. Okay. So I'm going to do a sensitivity test to the skin on your face. So if you could close your eyes, you're going to feel two different sensations, wet or dry. So this is going to be a dry sensation. This will be wet. Do you feel the difference?
Yes.
Okay, I'm just going to test different areas of your face. Just say wet or dry, depending on which one you feel.
Sure. Wet. Dry. Wet. Wet. Dry. Dry. wet, 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 dry, 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 wet, wet, wet.
Okay, that's really good. All right, I'm gonna palpate your head now. So I'm just gonna be feeling for swelling or edema, or I'm just making sure that your skin is symmetric. Let me know if you feel any pain.
No.
Feeling your preauricular lymph nodes, they're not palpable. Postauricular. Okay, just feeling. Okay, good so far. Okay. So I'm going to be bringing these two sensations from the center of your face to the sides. Let me know if you feel it equally on both sides or if you feel any numbness along the way.
Okay.
Okay, so if you feel it equally, just say yes.
Yes.
Okay.
Oh, maybe I feel it a little more on this side.
On the left side?
Yeah.
Okay.
Yeah, same thing.
Same thing?
Same.
Okay.
Same. More on the left.
More on the left, okay.
A little, this one was more equal.
More
compared
equal?
to the
Okay.
next.
So you would say you felt it more, the numbness on your left side is like here? Like
Yes.
From here to here?
Yeah.
Okay. Okay, I'm going to do some percussions on your face just to make sure that there's no edema. Very good. I'm just going to take a look inside your eyes real quick.
Okay.
Have you had any redness or itching in the eyes that you've noticed?
A little bit of itching.
Okay.
Because I have sensitive eyes and kind of like sensitive skin. So if I use something new, then it reacts to it.
It can get inside your eyes. Okay.
Yeah.
Do you take eye drops
I do not.
for that? Do your eyes get red?
Yeah, if I use something like a new product, then they tend to get red.
Okay.
And then it kind of gets resolved after like a few hours. So
Okay.
yeah.
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 I would recommend drops. I'll write down a prescription for you with this brand called Lumify.
Okay.
That really helps with not only easing the itchiness, but the redness.
Oh, perfect.
Especially in the morning.
Yeah.
All it takes is one drop a day.
Oh.
And it pretty much is good for the whole day. So see if you like it.
Yeah, I would love that.
Okay.
Anything that helps. So.
Sure. So for now, just look straight ahead for me. Just gonna look at your optic nerve. Very good. Your pupils are round and reactive to light, which is what we want to see. No jaundice or redness. Okay. Look at the other side. Okay, they look healthy to me, but I think the drops will help.
Okay.
Okay, so next I'm going to have you lay down and I'm going to just take an in-depth look at your scalp and your hair just to see what's going on there. Okay, Mahtab. So could you raise your head just like that? Good. Just going to actually inspecting a part of the hair.
Okay.
Inspection of the skin. Okay. I am seeing some just kind of red bumps here. I'm going to take a sample here. Okay. So the first neurological test we're going to do is a pressure point test.
Okay.
So you're going to feel this is one pressure point.
Okay.
This will be 2. Do you feel the difference?
Yes.
Okay. So go ahead and say 1 or 2 depending on how many pressure points you feel.
Okay. 1. 2.
Good.
2. 1. 1. 2. 1. 1. 1. 2.
Okay. Okay. I'm just going to measure certain parts of the scalp that I see red patches on just so I can record.
Okay.
Okay, that's this is abdominal, and that's on the right side. Okay. Okay, this one's larger. It's near the crown of the head, and that is 3 millimeters. Okay. This is just a half right here. Okay. Okay. So, do you feel the sensation?
Yes.
Does it feel kind of cold to you?
Mm.
Okay, so that's going to be a cold sensation.
Okay.
And then this will be warm.
Okay.
So say warm or cold.
Cold.
Good.
Warm.
Okay.
Warm.
Okay.
warm,
Good.
warm, cold,
Good.
warm, 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 cold, cold, cold.
Okay. Just say more. Good. Okay, so now I'm going to take this wooden device.
Okay.
I'm going to draw it from your part to your ear, or your part here. Let me know if you feel the sensation once, twice, or 3 times.
Okay.
1, 2. Okay?
Okay.
All right.
Once, three times. Once, once,
Good.
twice, three times. Once, once,
Okay. Okay, I'm just going to change the part. Sorry.
Okay.
Just going to get closer to your ear here.
Okay.
So you can lift your head. Good. Okay, and then I'll look at the skin around the ear.
Okay.
So this is definitely an allergic reaction
Okay.
because I don't see any irritation from this point here down. So it means that you did apply something that really irritated your scalp, which is very common.
Okay.
Looking here. Okay. Right. Just going to take another sample here
Okay.
of the skin cells behind the ear, just to make sure. Okay. Right. Continue to look. That's good.
Okay.
And I'm just going to do some quick measurements here.
Okay.
Barely any scaly patches. Barely any scaly patches. stretches. So I'm just going to record what I see here, which is minimal. All right. So this is 0.3. So it's a mild reaction. Okay. Here we have 0.25. Okay. So the bumps seem to be receding as they get close to your hair. The worst part is up here, and then it's kind of calming down towards the framing of your face. So I'm going to do a few tests though, just to gauge your acuity to different sensations. Okay, so again, this will be cold, and this will be warm.
Okay.
So see which one you feel.
Okay. Cold. Warm. Cold. Warm. Cold. Cold. Warm. 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 Cold. Cold. Cold.
Very good. Okay. This is going to be paper,
Okay.
and this will be plastic.
Okay.
So tell me, paper or plastic?
Okay. Plastic. Paper. 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 Plastic. Plastic. Paper. Plastic. Plastic. Paper. 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 Plastic. Paper.
Very good. All right. So one more test before we move on to your abdomen.
Okay.
This is a tuning fork, and I'm going to be placing it on different prominences of the face. You're going to feel a vibration and also hear it.
Okay.
And then I'll stop, and let me know when it's stopped. Okay?
Stop.
Good.
Stop.
Good.
Stop. 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 Stop.
Very good. So what I'm going to do now is apply an antibiotic serum to different parts of the scalp and part just to start the healing process. This is going to be a prescription that I send home with you.
Okay.
You're going to apply it 3 times a day. Okay. So I'm just going to get you started here. So you don't have to move at all. I'm just going to move on to your abdomen and begin that exam, okay?
Okay, thank you.
How is your head feeling?
It's feeling way lighter, and I can feel the hydration too. So.
Very good. I'm glad to hear that. Okay. Okay, so with your permission, I'm going to just lift your shirt just so I can have access to visualize your stomach.
Sure.
Okay. And I forget if I asked this, but is the pain more your upper abdomen or lower abdomen, or is it kind of all around?
It's kind of all around, actually.
Okay. All right, I'm going to take a listen. So you're going to feel a cold sensation, unfortunately.
Okay.
But hopefully it won't be too cold.
Okay.
Just need to listen to your stomach acidity and regurgitation sounds. Okay, I'm hearing a lot of gurgling, which could indicate gastritis. Something that you ate, maybe the fast food that your stomach just didn't agree with.
Okay.
And it's just building up a lot of acid and inflammation to the stomach lining.
Okay.
So okay. Just going to be palpating, okay? So I'm just going to be feeling your organs to make sure they're normal in size, okay?
Okay.
Okay. All right, your liver is normal in size. So is your spleen. I'm not feeling any hardness or enlargement of the organs. So that's good. Okay. I'm going to be percussing the stomach to just feel for swelling or edema. Okay, we're going to do kind of similar sensitivity tests as we did with the scalp.
Okay.
This is a pressure point test, so this is 1 pressure point, this is 2. Okay. Let me know which one you feel, okay?
1, 2, 1, 2, 1, 1, 1, 2.
Good.
2, 2, 2, 1, 1, 1.
Okay, so I'm not worried. So this is a cold sensation.
Okay.
And then this is going to be warm.
Okay.
Okay.
Cold, warm, cold, warm, cold, 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 warm, warm.
Very good. Do you feel the sensation? It should feel like a little tickle.
Okay.
Okay, that's going to be dull, and this is sharp.
Okay.
So say sharp or dull.
Okay. Dull, sharp,
dull, 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 sharp, sharp. Okay. So that concludes our exam.
Okay.
What I'm going to do is I want to send you home with a topical treatment for your scalp.
Okay.
Also, I'm going to put you on a bland foods diet for a while, and I know that you say you have a busy schedule, but it's really important to adhere to this while you heal from your gastritis. So any foods like rice, sweet potatoes, white chicken, cooked chicken, not fried.
Okay.
And just bland kind of foods like bananas, things that are easy on the stomach, just for a few days. You can have eggs. And after that, and while you have that diet, I'm going to put you on a few antacid medications, pantoprazole, and also just over-the-counter medications like Pepto-Bismol and Tums really are going to help. I'm going to call you in a week and see what that did for you, okay?
Okay.
All right.
Thank you.
Any other questions?
No, I think you covered everything. Thank you.
Thank you for allowing me to do this exam, and I'll see you out front, okay?
Thank you.